Hi, it's Melanie again. How are you? Okay, for everybody out there who has not been watching all of these 50 million videos, I should change shirts to make it more exciting because I've been wearing the same thing through everything. Okay, um, for everybody out there who hasn't seen my other videos, be sure to scan through my videos and check them out. It'll go through everything that you are going to need prior to surgery, everything you are going to need for the 2-week diet prior to surgery, your phase 2 for after surgery, phase 1, phase 2, phase 3, the end of phase 3, week 4. It's going to go over your minerals. It's going to go over, there's if you look in my video logs, everything will be listed what it is, so it'll make it easy for you to go into. I broke it all up into different categories so that way it would be easy. If you're looking for certain information, you can just go to one video. Okay, no matter what, please check out my video about minerals and vitamins. Very, very, very important for everybody out there, especially gastric bypass patients. Okay, future ones and experienced ones, veteran ones. Okay, especially you ladies, if you want to keep your hair. Okay, trust me, check it out. Okay, here we go. Guidelines after surgery. Serving size is about 1/4 to a half a cup. Okay, um, and a plate should be the size of about a teacup saucer. Okay, one meal should never be more than about 12 ounces or 1.5 cups for life. Okay, this is just general guidelines for after surgery, everything. I'm talking like at the end of your phases, so forth. Treat your new stomach like a baby learning to eat. Introduce one new food per day. Um, if a new food does not agree with you, put it down and try it again a few weeks later. Because you don't want to have dumping. Who the hell wants to throw up all the time? I sure in the hell don't. It could take up to 6 months to figure out what you can and what you cannot tolerate. Okay. Um, listen to your body. Take your time. Turn off the TV while eating. Um, go slow. Focus on how you feel. Hunger and fullness will be different than before surgery. One bite can be the difference between full and being sick and dumping. Okay. Plus, you don't want to be eating stuff that's going to get stuck in your pouch because you're going to have a small pouch, and the passageway that leads to the small intestines is going to be a lot smaller. And I've heard of a lot of people trying to eat stuff and then it getting stuck. Okay, very, very, very uncomfortable. Do not push yourself. Okay. Be sure to eat soft, moist foods. You cannot wash down a dry piece of food with a drink after surgery. So cook your meals in moist methods. Use a crock pot, boil, braise, stew, or cover food while cooking it to keep it moist. Actually, if you do that, it'll cook faster anyways, ladies and gentlemen. Okay, so put a lid on it. Daily exercise is critical with healthy weight loss after surgery. So hey, you know, I'm 237.4 pounds as of today. Okay, May 4th, or I'm sorry, May 3rd, 2012. I know there are people out there that are a hell of a lot bigger and that might be smaller. Who knows? I'm only 5'3". Um, but exercise. If you cannot get around, if you're too heavy and you can't get around and you have problems walking, sit down, have a little pair of weights and exercise your arms a little bit if you can't move. If you don't have weights, use a can of food or something. Dog food, whatever you got. Okay? Utilize what's around you. But exercise. Everything you do will burn calories. Okay? Very, very important. Exercise. All right? situation, and this is 1 year after surgery. Do not drink at all for the first year. You're not supposed to. Okay? Your stomach is healing. It won't be fully healed until after that year. Okay? So don't push it. Once you're able to drink alcohol, refrain from choosing beverages with bubbles such as champagne, beer, or drinks mixed with soda. Keep in mind, alcohol is absorbed more quickly into the bloodstream after surgery, so moderate is the key. Remember that alcohol is very high in calorie, especially mixed drinks, which can slow down weight loss. Okay? Yeah, remember, you can't get out of a DUI if you say, oh, I only had a half a glass of wine, you know, I had gastric bypass surgery. It's not my fault my alcohol breathalyzer was over the limit. Yeah, it is. Because you were told about it. Okay? You know, there was a story about someone trying that shit, okay? You were told about it. Don't do it. It's bullshit. Okay? And gentlemen and ladies, when you first start trying to drink again, if you do drink, I don't drink that much, but when you do drink, the first time you drink alcohol, do it at home, okay? Because you're going to get drunk a lot faster. You're going to catch a buzz a lot faster. Try it out at home first, take it for a ride, so to speak. And then if you want to drink casual with a dinner out somewhere, then do it. But remember, most of all, alcohol poisoning is even more, okay? It's much more risky for us after surgery to get alcohol poisoning. It's very easy for us to get alcohol poisoning. Very, very, very easy. So limit your alcohol, okay? Don't overdo it. All right. Drink 2 to 3 protein shakes per day for 48 weeks. Then only drink 1 protein shake per day. Once your weight loss slows significantly down, stop drinking protein shakes in between meals. Only use it as a meal replacement, okay? So again, 2 to 3 protein shakes the first 4 to 8 weeks. Then only 1 protein shake a day. Once your weight slows down and you kind of like hit a plateau, stop drinking them and only drink them as a meal replacement. And when you do, drink high protein, low to no sugar. Okay, we do not want sugar. Sugar causes dumping. Okay, so if you get your rocks off throwing up, hey, knock yourself out. I'm not gonna do it. Okay. Example menu, year 1 after surgery. Breakfast: 1 scrambled egg. Okay. 1 ounce non-fat cheese, 1 slice whole wheat toast, 1 teaspoon of sugar-free Jell-O. This is an example. That all was for breakfast. Okay. Lunch: 2 ounces of tuna, 2 teaspoons light mayo, slice of tomato and lettuce, 1 slice of lettuce, and 4 saltines. That all I just said would be for lunch, okay? And it doesn't mean slice a friggin' tomato a half an inch thick, okay? Common sense, people. All right. Okay. So we're gonna go over dumping syndrome, okay? Since there's so many people that are dumping, and everybody just doesn't know why, okay? Keep in mind, if you dump and there's blood in it, or if there's blood clots in it, call your doctor immediately, okay? Right off the bat, okay? If you have any kind of pain that is over cramping, okay? That is uncomfortable and does not go away, call your doctor right away. If you cannot get a hold of your doctor, have the on-call doctor call you back. That's what they're paid for, okay? Do it. It's no joke having this surgery, so do it. Okay, dumping syndrome for everybody. What dumping syndrome is, okay? Dumping syndrome occurs when undigested contents in the stomach are dumped into your intestines too quickly. When this happens, it can lead to severe cramping, lightheadedness, and sweating. Okay? Very few people experience diarrhea. Most people get dumping syndrome. Most people throw up. Okay? So again, severe cramping, lightheadedness, and sweating is a sign of dumping. Okay? And few people get diarrhea, but you can get it. Most people dump. They throw up. Okay. What is reactive hypoglycemia? Reactive hypoglycemia, or low blood sugar, sometimes occurs with dumping syndrome and can cause dizziness, flushing, heart palpitations when your heart flutters real fast, fatigue, being very tired and just washed out. On top of the syndrome of dumping. Okay, very important. This happens because when you dump, your glucose or sugar is digested very quickly, and the body makes more insulin than what it needs, causing blood sugar levels to drop. Very important. I know when I don't eat, I get really woozy. I'm not diabetic though, but I'll get flush. I'll sweat. I get the shakes. I know I gotta eat. So keep that in mind. Reactive hypoglycemia is basically low blood sugar, which occurs when you have dumping syndrome. It can cause dizziness, flushing, heart palpitations, fatigue, on top of dumping syndrome. Okay? What foods cause dumping syndrome is foods that are high concentrated, simple sugars, and fat, such as sugar and honey, ice cream, soda, pastries, cookies, regular pudding or yogurt, candy, regular jello, cakes, pies, juices, donuts, sugar, sweetened beverages. So basically all the shit we're not supposed to eat prior to surgery, you're not supposed to eat after surgery. Common sense, people. Okay? Complex carbohydrates such as fruits, low-fat, dairy, and whole grain products will not cause dumping. Okay? So, common sense. Sugar is a no-no. Nutritionist care to prevent and treat dumping syndrome. Avoid concentrated sweets such as sugar, cakes, cookies, pies, candy, and cakes, sweetened drinks, honey, and syrups. Okay? Consume a high-protein diet, moderate amount of fat. Avoid liquids with meals. Eat frequent, small meals. Stay hydrated. And if you are experiencing dumping syndrome symptoms, lie down until the feeling subsides. Okay? So for everybody who's dumping out there, apparently you are probably drinking too soon or during a meal, or drinking too soon prior to a meal, or you're consuming things we shouldn't be eating. Okay? If you're not sure if you're supposed to eat it, call the damn nutritionist. Okay? Then you won't be throwing up. So this is dumping syndrome. That pretty much covers dumping syndrome for everybody that's out there. The next video I'll be ending it with protein and basically a shopping list that'll help everybody go out there and get the kind of stuff that you're actually going to need. So we're not spending money on shit that we're not going to use. Okay? Or we can't use. So stay tuned for the next video, and I will talk to you then. Thanks. Bye.